Well, earlier I spoke to the Immigration Minister, Mark Harper, and asked if the government had been forced to focus on immigration in response to the rise of UKIP.
I mean, obviously the Queen's speech was written before last week's local elections, and of course this government's taken significant steps to deal with immigration from the beginning of this government 3 years ago. Obviously measures on immigration were in the Conservative manifesto, in the coalition agreement, and of course those measures have been bearing fruit because we've seen net migration fall by a third already, and we're on track to see that fall continue through the rest of this Parliament.
But new measures in the Queen's speech today, who and how many are you trying to target?
Well, the test really, it's very simple. We're trying to make sure that we continue to encourage people to come to Britain who are coming here to contribute, to work hard. We want smart students, for example, coming to our universities. We see the numbers of those increase. We want them to stay afterwards in graduate level jobs, to start up businesses, to contribute to economic growth and job creation. What we want to do is deter those who would only be coming to Britain not to contribute but to take.
I want to go and see a GP. How will they know if I'm entitled to that service or not?
Well, one of the things on health that we're going to do in the summer is we're going to consult on the details of this. What we want to do is make it straightforward for GPs and hospitals to be able to carry out those checks. We don't want to make it a huge burden for them.
But there are no details at the moment, are there? I mean, do you think that I'm going to have to take my passport along to the hospital when I break my leg?
Well, we certainly don't want to make it necessary for people who are going to have emergency treatment at hospitals to have to start having lots of paperwork. The whole point about consulting on the details is to get those details right. If you look at the reaction to our proposals when we first talked about them, actually a lot of GPs want a more robust system. They want us to continue having a free at the point of use national health service.
But they don't want any more work, do they? Why should they become your immigration officers?
Well, GPs want to make sure that we can continue having a free at the point of use national health service. And I think if you want to continue having a free at the point of use national health service, it can't be a free at the point of use international health service, which is what to some extent it is at the moment, that we don't have good controls on stopping people accessing the NHS who have no right to have access to it. And actually I think doctors want to make sure we have robust rules, but we also don't want to get in the way of delivering good medical care. So, for example,
you've got no idea how you're going to do that because you've got no detail, have you, today?
No, we're working through some of that detail. We'll be consulting on it because obviously we want to listen to the views of those that will have to implement it. The public, I think, would want us to take these steps seriously and carefully and then implement them when we've got the details right. So we've announced the bill, we've set out some of the changes, but we'll be consulting on the detail so that we get it right and that we make life easy for those people that have to implement it.